Dear friends, hello. Today I will tell you how vitamin deficiency manifests in our body or how vitamin function disorders appear. That also happens. If you watch this episode until the end, we will go through each vitamin in detail, what clinical symptoms occur when they are lacking and what happens in our body. Why do we sometimes lack vitamins, even if it seems like we eat properly and sometimes even take vitamins? I constantly hear the word avitaminosis, spring avitaminosis, autumn avitaminosis, winter avitaminosis. Friends, avitaminosis is actually very rare. Avitaminosis is when there are absolutely no vitamins in our body, and that's a critical condition. That's extremely rare. Most often, we're actually talking about hypovitaminosis, and those are two very different problems. With avitaminosis, the vitamin is almost completely absent, and you will always have very vivid specific symptoms. And that's why it's very difficult to link a deficiency of a certain vitamin, for example vitamin C, to a specific disease, because there's almost always a slight shortage. Hypovitaminosis is a lack of a vitamin or improper functioning of that vitamin in our body. Well, you know what vitamins are. Vitamins are what form the basis of life and the functioning of our body. And to keep it simple, remember that there are two types of vitamins. The first are water-soluble vitamins, and the second group are fat-soluble vitamins. As the name suggests, some dissolve in water while others dissolve in fat. Water-soluble vitamins are easy to remember. These are all the B vitamins and vitamin C. Fat-soluble vitamins are vitamins A, D, E, and K. The main difference is that water-soluble vitamins are easily absorbed, but they are not stored well and leave your body almost within a day. That's why, when you take water-soluble vitamins, you can see them leaving your body in your urine, as they make your urine very brightly colored. What else is important to know about water-soluble vitamins is that they are hardly stored in the body, so it's critically important not to take them in courses, but to have a balanced diet all the time. Because you don't need water-soluble vitamins just for 30 days in the spring or 30 days in the summer while you're taking something, but for all 12 months of the year. That's why the foundation of a healthy life is a balanced diet 12 months a year. Now let's talk about fat-soluble vitamins B. What's special about them? They are absorbed worse. Indeed, the body simply can't absorb them that easily. Secondly, they accumulate. Most often, they accumulate mainly in fat tissue. And vivid examples are vitamins. You know that vitamin A is often deficient, especially in people living in big cities. Vitamin E can also be deficient, but what's the difference? The main difference? These are fat-soluble vitamins. You can accumulate them, build them up, and end up in pathological conditions, for example, caused by hypervitaminosis. And that's also a third condition. We've only talked about deficiency, but hypervitaminosis is also not always a good thing. For example, you can have pathological concentrations of vitamin E or vitamin D. Vitamin D is widely consumed in large doses on a regular basis, which is an appropriate practice. In some situations, when you have a severe deficiency, but you always need to monitor the dosage. Because at first it's a medicine, but gradually it can turn into a poison, and instead of helping, it will poison your body. So if you don't take vitamins and you live in a big city, you probably have a deficiency. But I don't recommend taking them blindly. Now let's think about why these vitamin deficiencies happen in the first place. You seem to be eating right. Most often it's because some people don't absorb vitamins well. So you seem to be getting them from food, but you don't absorb them properly. You have a particular feature in the functioning of your gastrointestinal tract where, for example, you don't absorb fat-soluble vitamins well. The second reason is the products themselves that we consume. More and more often we turn to genetic engineering and fast-ripening products. In principle, they are harmless by themselves. But because the ripening cycle, for example, has become shorter, it simply doesn't have enough time to absorb all the necessary vitamins. Plus, and this is very important, it's not only plant-based products, but also animal-based ones. They are also sources of vitamins, and the amount and concentration of vitamins in them varies in spring, summer, and winter. Let's take, for example, a chicken egg. We're all used to thinking that a summer chicken egg is exactly the same as a winter one. No, that's not the case. They are different. Both animal products and plant products are different. What's also very important is that today's products, not only are they poorer in composition by themselves, but they are also more often heat processed. These aren't village products where you take a freshly laid egg from a chicken and eat it right away. Most often they undergo certain processing. The products, by the time they reach you, are either fried, steamed, or have been stored in the refrigerator for a long time. And of course, the quantity and quality of vitamins contained in them decrease. That's why, even though the foundation is healthy eating, sometimes additional sources in the form of specific products are needed. Yes, maybe you don't want to eat, for example, sorrel, or you don't want to eat citrus fruits, but your test results say that you need to do it. Or additional sources of vitamins are good vitamins in the form of dietary supplements, which also helps a lot, especially, for example, for a city dweller in winter to get the right amount of vitamins. Friends, let's not limit ourselves to just vitamins. 98% of my subscribers on the channel are men. And those who do sports, take care of their health, care about their longevity, want to live long, look good, and feel great. It's specifically for you that I'm offering a free opportunity to follow the link under this video to my masterclass about a healthy lifestyle and testosterone. There, I will also proudly present to you my project Fitness as Science, so go to the link under this video for the free webinar and register for the next live session. But people say, I've never eaten a certain product in my life, or I've never liked, for example, foods rich in a certain vitamin, so why did I suddenly develop a deficiency that I never had before? Since moving from Sochi to Moscow, you've experienced poor climate conditions for most of the year, with slush falling from the sky, a lack of sunlight, and smog everywhere. And of course, you used to get it before, but now you don't, or maybe you changed your type of work, you used to be an office worker. Then you quit everything and started doing sports professionally, and your need for vitamins simply increased. Professional athletes and even amateur athletes have different vitamin requirements compared to an average person. That's plus 30 to 40%. So what used to be normal for you before may no longer be normal for you today. That's why if you know you're going through a tough period at work, preparing reports, writing a dissertation, or experiencing a lot of stress, your need for vitamins will increase. Why do we get sick when we're stressed? Why do we get sick when we're preparing for competitions? Why do we get sick when we're under heavy loads? It's not magic, it's just that the amount of vitamins we need increases, but our intake stays the same. That's why, friends, don't wait for clinical symptoms. If a period of your life feels difficult or challenging, such as during a divorce, court case, or exams, please help your body get through all of this. My main recommendation, especially for guys with darker skin, for guys, let's say people from the Caucasus region who are genetically used to living in different climate conditions, your vitamin tank is very small. When you come back from vacation where it seems like you've stocked up on vitamins, do you think it will last you a long time? Actually, you'll have enough for less time than anyone else. And your need for it and sensitivity to it are higher than anyone else's. This is what I was talking about regarding moving to a new place under stressful conditions. The normal amount of vitamins is actually different for everyone, and it depends on your genetics as well.
There's a popular remedy. If you feel mild signs of a cold, you should take an effervescent vitamin C, 1200 milligrams. Drinking it all at once won't make you better right away. Such claims are not effective.
Listen, honestly, we're unlikely to recover just from vitamin C itself, especially if we have a bunch of other problems. You know, there's this picture on the internet of a huge house fire, and it says things like poor nutrition, sleep disorders, and a bunch of illnesses. And there's a guy trying to put out the fire with a dropper, and on the dropper it says vitamin, and above it, apparently it says doesn't work. You shouldn't have any biased or deep meaning attached to a specific vitamin. Vitamin C won't instantly protect you from illness, but it will boost your immune system and benefit your body, particularly if you're deficient in it. When workloads increase, I sometimes give consultations to handle the high patient volume. I can just dissolve vitamin C for myself and sip on that fizzy drink over several hours. It's easier for me. But still, it's not necessary to take vitamin C if you don't have a deficiency. If you don't have a deficiency, it won't have any magical effect. So yes, a little lemon or maybe vitamin C tablets might help, but you shouldn't treat it as a cure-all. Especially when people say, I got sick, so I'm taking vitamin D. It won't increase that quickly, my friend. You should have started taking it a month ago. That's why when COVID was spreading, everyone was given vitamin D as a preventive measure, and those recovering from COVID were advised to continue taking the vitamin for an extended period. This was to prevent getting sick again in a short period of time because not everyone developed antibodies. And after a severe illness, the body remained very weak. Let's think together, what else could cause you to have a vitamin deficiency? It seems like you have food, maybe you even take vitamins, but you still have a deficiency. Antibiotics and a number of other drugs, for example, anti-tuberculosis and anti-inflammatory medications, can themselves affect how your body absorbs vitamins. That's why it's very important not to take a deficiency out of context, but always try to look for the cause and effect relationship. Why? Maybe some medications that your doctor prescribed are actually preventing your body from absorbing vitamins. It would be foolish not to mention such an important thing as the risk group. It includes not only, for example, people who live in the north. Naturally, they are at risk for vitamin deficiency, but who else is in the risk group? Let's think about it. That's right, pregnant women, because it's a huge strain on the body, and you've probably seen that there are even special groups of vitamins for pregnant women. Why do they have a different composition? It's because the body needs more of certain things. When the fetus is growing, you know that iron levels can drop more actively, and there's a higher need for B vitamins. And if there's a deficiency of those, it will affect not only your condition. It's not just that your hair starts falling out during pregnancy. That's why you definitely need to check, because it will affect the health of your fetus. And the baby may be born with some pathological conditions, problems, or developmental defects if you have hypo or avitaminosis. Well, naturally, smokers, alcoholics, drug addicts, basically all idle citizens are also in the risk group for deficiency conditions. Now that we've covered the main things, let's look at which vitamins and at least roughly which direction to look in if you have any external symptoms, so that you can at least guess which vitamins to get tested for, because vitamin tests aren't cheap. The first ones are probably B vitamins. They are often deficient along with iron, because most often people who are deficient in B vitamins are vegetarians. Patients bring me their test results, which often reveal issues in their general blood tests, such as macrocytes indicating a vegetarian diet. Without judgment, I inquire further and discover that they are not consuming an adequate, balanced diet to meet their nutritional needs. If you lack essential plant-based or animal-based vitamins, compensate for the deficiency and check for common vegetarian symptoms. Let's remember, usually for girls, it's the cycle, and for vegetarians, for men, there are problems with hair. The hair becomes thin, it falls out. Secondly, they often have skin problems, especially the skin on their hands. It starts to peel and becomes dry. They constantly go around from morning till night, moisturizing their hands. Problems with nails, brittle, thin, dry, and the cuticles are dry too. This is a clear sign of issues. Also, the nervous system. Without vitamins, there won't be a normal nervous system. Problems with sleep begin, problems with psychological balance start, meaning the person becomes more irritable, their cognitive function worsens. You can't say their intelligence quotient drops, but their memory gets worse, they become more difficult, their sleep is disturbed, they start sleeping poorly, or don't sleep at all, or sleep very little, or their sleep becomes shallow. That's why these symptoms appear, so let's go and get tested.
Many sports supplements have vitamins added to them. For example, creatine complexes definitely often have vitamins added. They often just add them in bulk. In gainers, they add a whole bunch of vitamins. Or in vitamin complexes, even in zinc monomethionine aspartate, they add more. Basically, they add a whole pack of vitamins. Sports supplements are good. That's enough to not worry about a lack of vitamins.
Look at how it works with a vitamin deficiency. My producer just asked a really good question. He said, hey, listen, what about Vizima? Vitamins exist, or they're in some kind of sports supplement or meal replacement. Vitamins are everywhere. Even energy drinks have B vitamins. So should we just not think about them anymore, or should we actually still care? Because if your drink has all the B vitamins, but it's missing, say, vitamin B2 or biotin, then you'll have a specific deficiency in that particular group. So yes, that's good, but for example, you can't make up for vitamin B2 with zinc monomethionine aspartate, because zinc monomethionine aspartate usually only contains vitamin B6 and most often vitamin C. That's probably all about that. You know, if we start getting sick often, the first thing we need to check is our vitamin C level. Also, clinical signs of vitamin C deficiency are wounds. They start to heal slowly. If you cut your finger, it takes a long time to heal, and each time it also gets inflamed. This is also a sign of vitamin C deficiency. Vitamin C deficiency can also cause myalgia, characterized by unexplained unpleasant muscle pain, especially in the legs. Sometimes there can even be pain in the mouth and also bleeding gums.
Is there any limitation for vitamin C? Some sports supplements contain about 100 mg of the ingredient per scoop, such as in gainers. Effervescent tablets can have up to 1,500 mg. Is there any limitation at all? Or is it okay to drink as much as you can? How does it work?
Vitamin C, like other water-soluble vitamins, is actually pretty hard to overdose on. Because you excrete them in large amounts, you just can't retain them. That's why, in general, you don't need to worry when you take water-soluble vitamins. But you shouldn't overdo it either, because it's still an extra load. It doesn't just leave our bodies on its own, it's still a burden on our internal systems. Sometimes, if you have an excess of certain vitamins, you may experience allergic reactions. Vitamin K is often taken together with vitamin D, because very often, many symptoms that people associate with an excess of vitamin D are actually caused by a deficiency of vitamin K. That's why vitamin D is often combined with vitamin K. And some of the symptoms include dizziness, weakness, diarrhea. That is, you have terrible stools, even though you don't seem to be poisoned, and also bleeding gums and constant bruising. You bump into something and get a bruise. You bump into something and get a hematoma. You brush your teeth and they bleed a lot and take a long time to stop. Unlike, by the way, a vitamin deficiency state when there is bleeding, but it stops quickly. Why? Because we have a blood clotting system, and it is highly dependent on the level of vitamin K because of the blood clotting factors. They are based on and structured around vitamin K. If you have a vitamin K deficiency, your blood clotting will be very poor. Vitamin E deficiencies are actually quite rare. By the way, these deficiency conditions related to vitamin E don't often occur. But the classic clinical symptoms that are specifically related to vitamin E are vision problems. Vision problems, issues with the immune system, and hormonal imbalances. Because vitamin E deficiency can affect the production and metabolism of sex hormones. So, if you notice a decrease in libido, if you notice something is wrong with your vision and you start experiencing neurological symptoms like dizziness, please check your vitamin E levels. And another specific symptom can sometimes be paresthesia, tingling in the hands. Of course, you shouldn't assume it's definitely a vitamin E deficiency because your hand might tingle due to cervical osteochondrosis. But if you constantly feel some numbness or tingling in different parts of your body, it could be a vitamin deficiency. And vitamin D should definitely be mentioned as well because it has specific symptoms. You may experience hearing problems, declining hearing, vision issues, or develop dry eye syndrome. You constantly have to moisten your eyes. You buy and use drops that moisturize your eyes because they are always dry. But the real reason is actually a vitamin deficiency. Or, for example, the appearance of spots on your eyes, which are uneven and specific. Also, vitamin A deficiency can cause night blindness. If you've noticed that your vision has gotten worse at night, please check your vitamin A levels. Why do we even develop hearing loss? Why does our hearing deteriorate? The thinnest elastic fibers are found in our eardrum, and it affects their synthesis. A vitamin A deficiency leads to impaired synthesis of elastic fibers in the body. With a severe vitamin A deficiency, blindness can even develop. I'm talking about the vitamins I mentioned. Of course, you immediately start asking questions. What foods should we eat to compensate for this deficiency? Because primarily, I'm always in favor of proper nutrition, but in the video format, it's not very convenient for you. That's why on my channel, I'll explain the vitamin requirements in detail. And I'll probably make a whole collection like articles and recommendations about vitamin requirements, so it will be more convenient for you to get the information. So, the link to my Telegram channel is in the description below this video. This vitamin is a very important vitamin. And why is it important? Because without it, it's silly to talk about good sleep. It's silly to talk about a healthy nervous system, healthy blood vessels, our reproductive system, or our hormones. But everything in our body is connected, revolves around this vitamin, and in fact, it's a hormone. And we partially produce it ourselves, partially get it from food, and still, But even sometimes, even when we seem to be in good climatic conditions, we can't get the proper amount of the vitamin. And considering, you know what the sun is like these days, even if you're unaware of your need for the vitamin or the low risk of developing melanoma, it's crucial to monitor and keep track of your vitamin levels, as it is very important. Many people struggle to increase their vitamin levels even with supplements. Some can't absorb tablets, requiring injections instead. That's why we always check the vitamin if we're talking about a healthy body. The list of functions it affects is endless. Vitamin deficiencies often manifest as other deficiencies, such as calcium deficiency masking an underlying vitamin deficiency. A woman may have osteoporosis, or a man can also have osteoporosis or osteopenia. They start giving him calcium, telling him to consume dairy products, but he takes it and nothing works. Nothing is absorbed. His osteoporosis progresses, especially if it's an elderly woman with low estrogen, which already leads to bone tissue demineralization. And of course, we shouldn't treat the consequence. We should treat the root cause. And this applies to all the vitamins I mentioned to you today. Treating consequences, runny noses, osteoporosis, or low testosterone is unnecessary if the root cause remains unaddressed. Taking testosterone or calcium supplements is not needed in such cases. You don't need to buy expensive creams and put them on your dry hands or try to fix hair loss with lotion.
Nutritionists are now split into two groups. Some say everyone urgently needs vitamins, get tested right away, everyone should take them. Others say, what are you doing? Vitamin D is a hormone, you shouldn't overdo it, and it can mess things up in your body. How should you approach taking vitamins wisely?
That's an interesting question. In reality, the truth is always somewhere in the middle. There are people who like to say things that contradict everyone else just to draw attention to themselves. There are people who are simply ignorant. There are people who, for example, hold some kind of position. He is an endocrinologist who presents the official stance of the Ministry of Health. It differs significantly from international recommendations, such as the vitamin dosage. We produce the vitamin. We know that even though it's a good dose of the vitamin, in order to raise the vitamin level, 5,000 per day, for example, or 3,000, producing more than 2,000, and even then with a caveat, is this for pregnant women? You can't, because the Ministry of Health says 600, but you won't be able to fix any deficiency with a dose of 600 per day. And unfortunately, there are a lot of gaps, things that professionals haven't gotten around to yet. And bureaucracy eats up the proper recommendations, which I hope bright minds will eventually bring to our system. That's why we shouldn't fall into radicalism, like only listening to nutritionists, only listening to uneducated coaches, or only listening to doctors. What you really need to do is listen to your own head, where you've put the right knowledge. Knowledge based on global recommendations and guidelines, not just what's written in certain textbooks. Friends, the most important thing is not to be like a weather vane. You heard some blogger and now everyone is taking vitamins? Another blogger said vitamins are bad, so now no one takes vitamins. Don't fall for provocative videos that people make just to get attention, because saying that vitamins are good and you should take them, that's what we ourselves, for example, are planning to produce now, and why aren't we producing it yet? I want to produce high-quality micellar vitamins by summer, so I'm avoiding making low-quality ones. Regarding water-soluble vitamins, for some people, the cheapest, simplest vitamins are enough. They will absorb everything just fine. There are certain conditions when you even need to use injectable B vitamins, and by the way, they are quite painful. The same goes for vitamin C. It can come in different forms, like ascorbic acid or ascorbate, and the price can vary 3 or 4 times between them. Only one will be more beneficial. It will be less harmful to your gastrointestinal tract and less likely to trigger, for example, a gastritis flare-up. So you shouldn't think that if it's a water-soluble vitamin, then any kind will do. No, that's not the case. Don't assume that taking more is better just because it doesn't accumulate in the body. For example, sometimes you see vitamins in colossal, huge amounts. All of this puts a strain on the body's systems. If, for example, you have a predisposition to urinary stone disease, it can become a provoking factor for stone formation. An excess of vitamin C in your urine can become a matrix for stone formation, and instead of benefiting from vitamin C, you end up with kidney stones.
So how do you figure out if it's enough to take vitamins in pills, or in what cases should you even get vitamin injections? That's why bodybuilders and others like them get injections.
Many vitamins, including those popular among bodybuilders, don't need to be injected, as taking them orally is sufficient. Usually, we use intramuscular injections when there is some acute condition specifically caused by vitamin deficiency, when we want to recover from a pathological state more quickly. Or if there is a problem with vitamin absorption, then yes, but most often water-soluble vitamins are not needed. But there are situations when, for example, a fat-soluble vitamin is poorly absorbed, even in tablet form, especially in certain pathological liver conditions. For example, in fatty hepatosis, it is poorly absorbed. It just doesn't write. It doesn't work. No matter how wonderful the vitamin you use is, then the intramuscular form or simply a more convenient form is needed. You can avoid taking daily vitamins or using forms every other day by opting for an injection once every month and a half, allowing you to forget about the vitamin altogether.
Carbohydrates can be simple or complex, and proteins can also be different. But are there also right and wrong vitamins, or are they all the same? Earlier there was something Marcella mentioned here. What is that? Are there different forms of vitamins? Can you explain this in more detail?
Look, here we have a vitamin, yes. And in order to absorb a fat-soluble vitamin, the body needs to create a shell, a so-called micelle. That is, it surrounds the vitamin, and only inside this shell can it pass into the bloodstream through the wall. Without it, in its native form, no matter how much of it there is, it hardly penetrates at all. This is a characteristic of all fat-soluble vitamins, and the number of elements that create this shell is very limited. That's why deficiencies of these elements prevent you from quickly correcting the deficiency state and hinder proper absorption of fat-soluble vitamins. And there are me-sliced vitamins that are already in this capsule. They are resistant to thermal exposure, to cold, to heat, resistant to physical impact, and they are resistant to alkalis and acids. They are absorbed in a ready, available form in the necessary part of the intestine. The vitamin inside is the same, but the absorption is different, and since it's absorbed better, you don't need a huge amount of the vitamin. The amount of vitamin in it is less, it's available, it's more easily absorbed, and it puts less strain on your body, because all these excesses still need to be eliminated. The vitamins are often the same, but their bioavailability is different. I wish you a good mood, the right levels of vitamins in your blood, and of course vitality.